I don't think I have it.
If not, there's no issue. There's no issue. Okay, the Minister has 10 minutes.
Okay, Last Concord, I welcome the opportunity today to address the House on the new Children's Hospital project. I cannot accept the Deputy's motion, and I'm moving the Government's counter-motion on the development of new Children's Hospital. Sorry, my apologies. Outpatient and urgent care centres. Over the past number of weeks, there has been much debate and discussion regarding the development of the new Children's Hospital and the increase in the cost of the budget. When Government approved the construction investment decision in April 2017, the capital cost for the delivery of the hospital build project, following the evaluation of main construction tenders and selection of preferred contractors, was 983 million, of which 916 was to be met by the Exchequer. In December 2018, my colleague Minister Harris advised Government that the overall cost to the complete project is €1,433 million, €450 million more than advised the Government in April 2017. 319 million of the additional cost relates to construction costs, and the balance of 131 million, which includes 50 million in VAT, relates to costs associated with staff, consultants, planning, design team fees, risk, contingency and equipment. Both as a member of government and as an individual, I find the cost escalation of this project over what originally committed to by government in 2017 deeply disappointing. The government wants to get to the bottom of the major and sudden cost escalation associated with the finalisation of the GMP in November 2018 and the lack of timely warning when the capital budget was under such pressure. That is why on the 18th December, at the same time as the Government approved the construction investment to allow Phase B of the hospital to be instructed, Government also approved the commissioning of an independent review of the escalation in cost. This independent, comprehensive review process is underway and will examine the contributory factors and associated responsibilities so that any potential weaknesses are identified and comprehensively and speedily resolved in the interest of the successful completion of the project and the effective management of public funds. The review's terms of reference also require the review to develop recommendations which may identify any areas of potential cost savings or reductions which are consistent with the applicable contractual undertakings and the delivery of the project. It is also required to address major residual risks, control and oversight issues and bring greater oversight of performance and value for money. The Department of Health, the HSE and the National Paediatric Hospital Development Board are fully committed to collaborating with the review and implementing any recommendations arising. The report from this review process is expected to be completed by the end of March. The Government's investment plans, as outlined in Project Ireland 2014 and the National Development Plan 218 to 227, which provides for a substantially increased capital funding commitment of €10.9 billion for the Public Health Service, includes a substantial capital investment in 2019 of €642 million. This will continue significant capital investment in the health services in addition to the new Children's Hospital and urgent care centres at Connolly and Daly. The revised estimates adopted by Government for 2019 provide for the costs arising this year in respect of this priority project. The costs in future years will inform future capital expenditure plans. The location of the hospital has been a source of much commentary for many, many years, and let me be clear, we are building the main Children's Hospital on the St James's Hospital campus. The hospital is under construction, as anybody who goes down to visit the site can see. A fully aligned 57-month programme has been agreed with the main hospital construction to be completed by July 2022, followed by a period of commissioning and staff familiarisation before services transfer. We are also building an outpatient and urgent care centre on the grounds of Daly Hospital and an outpatient and urgent care centre on the grounds of Connolly Hospital. Works at Connolly are on target for practical completion of the building in spring 2019, with the opening scheduled for July 2019. The outpatient and urgent care centre at Connolly will start delivering improvements to healthcare for children this year under the responsibility of the Children's Health Ireland Works. Children's Health Ireland Works at Daly are underway with a target handover date of July 2020. The Government's decision in 2012 to locate the hospital on St James's Hospital campus was clinically led and made in the best interests of children. Dáil Éireann endorsed this decision in November 2012 on foot of a government motion. The site at St James's Hospital campus was chosen due to the co-location benefits, which ensures access to adult specialists for children and young people with conditions which are more common in adults. The joint management of these conditions by adult specialists and paediatricians can provide better quality clinical care, for example in cancer care for adolescents and young adults. Practising clinicians have expressed their full support for the St James's site, recognising the clinical benefits of co-location. By bringing together a full spectrum of subspecialties in paediatrics and neonatology on a single campus, supported by adult services subspecialities, a degree of scale and critical mass can be attained that will support better outcomes from the most complex treatment and care for the sickest children and young people of Ireland. I also want to be very clear and assuage any concerns that there may be in this regard. There is capacity on the site to accommodate a maternity hospital. This was recognised in the planning application and planning approval given for the site. A site for the proposed maternity hospital is identified in the site master plan for the St James's campus, and the new children's hospital design has incorporated the required operational links with both maternity and adult hospitals. Indeed, when it was announced in June 2015, the Coombs Women and Infants University Hospital will relocate in time to the St James's campus, achieving tri-location of adult, paediatric and maternity services. The National Maternity Strategy, published in January 2016, reaffirms the delivery of tri-located maternity services on the campus with the new Children's Hospital and St James's Hospital. Ultimately, tri-location will facilitate the transfer of sick newborns from the maternity hospital into the Children's Hospital and the transfer of critically ill mothers from the maternity hospital to St James's Hospital. The new Children's Hospital has been designed to meet projected child population growth and unmet clinical need, which will result in a facility that can provide for a very significant expansion in the delivery of healthcare. Reference has been made to car parking. The design of the hospital has recognised the need of most parents to access the hospital by car, and 675 spaces have been provided for families based on current and projected future demand, and 325 for staff. That's 1,000 in total, 3 times the current number of parking spaces for existing paediatric hospitals. This safe, underground parking system will also allow families to reserve spaces ahead of arriving to the hospital. There is some concern regarding the underground nature of the car park and its particular application to this project. As we all know, underground car parks are commonplace. I am happy to confirm that the fire safety certificate granted by Dublin City Council for the new Children's Hospital covers the car park. It is important that we do not forget the purpose of this project is to deliver transformational change to the delivery of healthcare for children in Ireland. The desire of all political parties, groups and members to improve and prioritise medical outcomes for the nation's sickest children is evident. We know that the children and young people of Ireland have been waiting far too long for a modern healthcare facility. With the development of new Children's Hospital and the 2 outpatient and urgent care centres at Tala and Conley, we are replacing outdated hospital buildings with modern and appropriate infrastructure, including fit-for-purpose single ensuite rooms for every child, designed to best serve the needs of our children and their families and of the staff who care for them. The centres will expand outpatient and urgent care capacity and provide services in modern facilities. Overall, the 3 new sites will significantly increase capacity across all types of care, including increases of 16% in inpatient capacity, 7% in emergency department attendances, 26% in day case capacity and 47% in outpatient capacity. These are significant figures indicating the scope of improvement that children and their parents will experience. This new Children's Hospital project will transform the delivery of children's healthcare in Ireland. The capital investment will be underpinned and complemented by a new model of care for the delivery of service to children. The establishment of Children's Health Ireland by legislation passed by this House at the end of last year was a major milestone in the new Children's Hospital project and will further assist the ongoing operational integration of the 3 hospitals in advance of the opening of the new Children's Hospital and outpatient and urgent care centres. The new hospital will have a leadership role nationally in the implementation of the national model of care for paediatrics and neonatology, working closely with paediatric service providers in other hospitals across the country in the primary care service and in the community. I firmly believe that this hospital is the right hospital on the right site and being built for the right reasons. Government considered 3 options, including pausing the project, retendering and delaying the project or proceeding. We made the decision to proceed. Finally, I invite members of this House to join me in ensuring that, while recognising and meeting legitimate concerns, we get on with delivering this vital project.